Priority to both of us is that our patients do really well, and also that we both feel comfortable in the operating room with the procedure we're doing. And because of our combination, there's really there's no case I can think of that we can't conquer together, which is really impressive.
So here at Orthopedic Specialists of Seattle, we take on some of the most complex cases in the city and really in the Pacific Northwest and potentially even nationally. Our group of subspecialty physicians and surgeons are really first class in their field. We commonly will see very complex patients that require not only one specialty, but potentially two specialty practices. And we come together to provide our patients with the best specialty care that they can receive, whether it's one specialty or a multitude of specialties. We frequently partner together in the operating room and in devising treatment plans. And we find that to be a really special part of our practice. We really enjoy working with each other. We're not only partners, but we are friends as well. And ultimately, that makes our jobs really fun. And we find that working together really helps provide great patient outcomes. So Dr. Garcia and I commonly operate together and see patients, complex patients that have conditions that require potentially two subspecialty practices coming together. And oftentimes that involves joints that have nerves that traveling close to the joint. The big ones that we will see are elbows. We'll as well see knees and hips that also have issues associated with them, whether it's a tendon injury that involves a nerve or a nerve complication after a previous surgery. These are all things that we'll often see together. So commonly around the elbow, we do arthroscopic surgery. The main nerves to the hand, the ulnar nerve, the median nerve, and the radial nerve are really close to where the arthroscopic portal sites are, the sites where we put in the cameras and the working instruments. And so my job during these surgeries is to find those nerves and protect them. And then Dr. Garcia, with his sports background, will do the work inside the elbow arthroscopically. And we find this to be a really safe way to do these complex operations that potentially have a higher risk of a nerve injury. So diagnoses like elbow arthritis and stiffness can be done safely arthroscopically, and we increase our safety by making sure that the nerves are protected during those cases.
And I think to add to that point, especially with the elbow arthroscopy, for standard cases, it's less common to see two surgeons combined, but we've noticed over the last 5 or 6 that we've done that we have a little added technique we do to reduce ulnar nerve symptoms. And you may hear from your surgeon that those don't ever happen, but we've probably seen a handful from outside facilities that have had ulnar nerve issues. And there's a number of data that shows us about 2 to 3%, even with the best surgeons. We've been very fortunate enough not to have any issues because there's certain techniques that we use to reduce that. It doesn't mean we're above it, but it means that we take it seriously. And honestly, my threshold for an injury is 0%. And so if I have to be humbled and add a surgeon to reduce a 1% complication risk, I will do that every single time for the patient. So, and again, nothing's too simple. No surgery is too simple. No surgery is without complications. And our whole goal here with those elbow arthroscopies or those arthritic elbows is to say, can we give someone the best possible outcome? Can we not delay the surgery in terms of taking too much longer when you have an added surgeon? And usually it actually is more efficient, as we mentioned before. And can you reduce complications? And that's really the benefit of the way we work together. So
it really comes down to clinical decision making, and part of specialty training and expertise and practice experience is in a lot of ways knowing what you're good at and knowing what your friends and partners are good at as well. And finding partners who are complementary in terms of skill sets. And so for me personally, if I see a patient who has a combination of potentially nerve injuries or instability of a joint, my expertise is really the nerve side of things. And Dr. Garcia's expertise is really stabilization of joints. And our specialty training in both those fields are really complementary because those injuries oftentimes come together. And so in a lot of ways, patients will get a 2-for-1 special when they see Dr. Garcia and I, because they get both a sports specialty trained physician as well as a hand and microvascular surgeon as well. Orthopedic Specialists of Seattle and within our practice is providing the best outcomes for our patients, and we're really a patient-centered practice. And so we like to create super surgeons. So we combine both of our skill sets to give you the best surgeon that you can get.
I think as you heard from Dr. Weil, this is an important aspect that patients are looking for too. A lot of times patients, we see a fair number of second opinions here. And the problem is that patients come in not feeling comfortable with the options they were offered, because a lot of times the second surgeon was not ever offered at all. And that thing we offer the second surgeon for these certain cases, that actually brings a level of comfort to the patients. I mean, the number of patients that I do an elbow arthroscopy on, I say, listen, my hand partner is going to be available. Or some of these high-level baseball players where, from both of our training with high-level professional athletes, most of the time a professional athlete's getting surgery, they are not having a single surgeon. And so a lot of patients don't realize that. But the fact is, we're basically providing that professional athlete care to more patients, and we can do that easily because not only do we have our own surgery center and we work together well, but we're able to coordinate our schedules and make sure that, because again, priority to both of us is that our patients do really well, and also that we both feel comfortable in the operating room with the procedure we're doing. And because of our combination, there's no case I can think of that we can't conquer together, which is really impressive.